Hi, my name is Karen and I'm an Australian Lyme patient. I've been wanting to do the Lyme disease challenge for a while now, waiting for a good health day, but it doesn't seem to be going to happen, especially with my lungs and my swallowing and talking at the moment, so let's just do it. Lyme disease or Lyme Borreliosis can come in many shapes and forms, depending on infection, depending on genetic makeup, depending on other infections at the time, and of course depending on country of origin. There's over a dozen species worldwide that can cause infections, and within these species it has numerous strains. My challenge would be to the Infectious Disease Society of America, the IDSA, with regards to the guidelines for 4 weeks of treatment being sufficient, no matter whether it's an acute infection or a chronic infection. Borrelia, the bacteria responsible for Lyme disease, has been found in bone, muscle, tissue, brain, as well as cerebrospinal fluid within days to weeks after infection. So how is that possible? 4 weeks worth of treatment is enough. You have something like a bacterial skin infection such as acne, and yet you can have 2 years worth of doxycycline for your bacterial skin infection, and yet for Lyme Borreliosis no longer than 4 weeks. I challenge all doctors to question the science and research this and ask why. The diseases like tuberculosis are known to be covered by the immune system or carried within the body and then set off and triggered further down the track. Same with Lyme, is able to sit latent and then trigger down the track. Also, something I challenge doctors to is to look at the literature with Parkinson's, multiple sclerosis, motor neuron. All of these are not susceptible or subjected to blood tests or any type of testing. They're a disease by which the diagnosis is a clinical diagnosis. So Borrelia, in which there is so many species and so many strains, where the blood testing is infamously incorrect, why is it not subjected to the same principles of clinical diagnosis? There are hundreds of thousands of patients around the globe that get Lyme disease each year, and the treatment, if early, is successful. If as for my case, years down the track, has disseminated throughout the body and caused multiple problems. So the Lyme disease challenge, take the challenge, take a bite out of Lyme, which I have multiple Lymes to show that it can be various and differ across countries. If you're in Australia, donate to either the Lyme Disease Association of Australia or the Carl McManus Foundation. They're two registered charities, one in Australia. Europe is ILAD Society. I think the UK has different ones. Look at various ones as to take a bite, donate, and help get further research. Cheers.